Hello and welcome to Good Life, the health show with me, Reshma Heather. Well, this is a show that focuses on providing with solutions to health-related issues, lifestyle and much more. We have with us today Dr. Rohit R Ranade, Gynaecology consultant and robotic surgeon from Narayan Health City, Bengaluru, and shall share with us about the Gynae-Oncology and its recent advances. Well, worth mentioning here is that Dr. Ranade is the second person in India to be awarded MCH in Gynae-Oncology, a 3 years MCI recognized super specialty course. Well, welcome to the show, Doctor. Well,
Namaskar.
And so can you tell us about the Gynae-Oncology and who is a Gynae-Oncologist?
Yeah, first of all, thank you for having me on the show. It's a pleasure to be in the state of Assam and the city of Guwahati. It's an excellent city. So coming to your question, what is Gynae-Oncology? Now, Gynae-Oncology is basically a branch of oncology which deals with the cancers occurring in the reproductive system in women. Mainly it includes cancers of cervix, that is the mouth of the uterus, then the ovary and the fallopian tube and the vagina and vulva. These are mainly the cancers that are covered under Gynae-Oncology.
So, saying about that, what is the gynecological cancers and which are the most common cancers, if we have to say about the gynecological cancers?
So, it's a problem which is very rampant, not just in our country, but also across the world. So, the commonest gynecological cancer still is called as cervical cancer. Cervical cancer is known as mouth of the uterus in layman terms. It is called as cervix cancer. It is the number 2 cancer in women in India. And we see about more than 1 lakh cases every year. It is very unfortunate that I have to state at this point of time that there is a death because of cervical cancer every once in 8 minutes due to cervical cancer. The second most commonest cancer is the ovarian cancer, which is known as it is called as the cancer occurring in the ovaries. That is also increasing in the incidence, and we are seeing the cases increased in ovarian cancer. What is very sad to know that more younger patients are coming with ovarian cancer. The third most common cancer in women is known as the endometrial cancer or the uterine cancer, the body of the uterus cancer. That is a cancer which was seen mainly in women more than 50 years of age, but now we are seeing more and more younger population come with these cancers. So broadly, these are 3 most common cancers in Gynae-Oncology, and there are other less common cancers like vaginal cancers or fallopian tube cancers or rare cancers like choriocarcinomas.
Well, saying that, adding to that, what is the cancer percentage if we have to say about India? So what is the rate if you know the percentage?
So India, as I told you that India is one of the countries, we are the second most populous or the most populous country in the world, and our cancer incidence is also on the higher side. Cervical cancer is the second most common cancer in women in India after breast cancer, and ovarian cancer is the 4th most common cancer. So the incidence of cervical cancer is about more than 1 lakh patients, new patients of cervical cancer we get every year. Ovarian cancer, it is about 30,000 to 40,000 new cases per year, and uterine cancer is about same between 35,000 to 40,000 new cases per year.
So having stated about the gynecological cancers, like when do you want to recommend a patient to come over to a gyne-oncologist?
Yes. So that is a very important question, because unfortunately in our country 70% of cases are still diagnosed in advanced cases. So that primarily means that we are unable to detect them and refer them to a specialist at a point where they can have a much better survival. Now, who needs to see a gynecologist? Now, somebody who has a diagnosis of cancer, where you have a biopsy which is suggesting that you have any one of these cancers, or there is a test such as an ultrasonography or a CT scan or an MRI which is suggesting of either a tumor or a lump in the abdomen, which can be from the ovaries, from the uterus or from the cervix. Or if you have persistent symptoms like excess bleeding during your cycles or excess white discharge or bleeding after sexual activity. These are cardinals. Or you have an unexplained weight loss. There is just you're just having a weight loss which is not explained. So in those situations, you should seek the help of a gynecologist.
So one-on-one, stating about the key signs of cervical cancer.
Yes. So as I was talking to you, the key signs of cervical cancer, the most important sign is bleeding, excess bleeding in between cycles. The second most common sign is excess white discharge, especially if it is foul smelling discharge. Then post-coital bleeding, that is bleeding after sexual activity. That is also, these are three most common symptoms of early cervical cancer. The other symptoms include pain in the abdomen or difficulty in passing urine or unexplained weight loss. These are the commonest symptoms of cervical cancer.
So if we talk about the symptoms for ovarian cancer.
Yes. So ovarian cancer is one disease where symptoms are very, very non-specific. That is why majority of the cases are, as I told you, are detected in late stages. Now, it can be very non-specific, like your abdomen gets distended, that is swelling of the abdomen, or you are just a sensation of not being well. You might be lucky that you might have an ultrasound which is suggestive of a large ovarian cyst. Also, some women get symptoms that they have to go and pass urine more frequently because the ovarian mass presses on the urinary bladder, and you get a sensation that you have to go and pee more in frequency. Also, this can be symptoms about motions as well. Okay. So overall, these are symptoms of ovarian cancer.
So is ovarian cancer and womb cancer the same?
No, womb cancer is uterine cancer.
Okay.
That is the cancer of the uterus. In a female reproductive system, the uterus is in the center and the ovaries are on the sides.
Okay.
So
yeah.
Yes. So essentially, womb is the baby bag where the pregnancy is born, which is called as uterus.
Okay. So I went through a cancer that is also called endometrial cancer. So
yes.
What is it?
So now endometrial cancer is a type of uterine cancer. Now the uterus has three layers. It has an outermost layer, it has a middle layer which is a muscle layer, and the innermost lining of the uterus is called as an endometrial layer. So the cancer arising from that lining is called as endometrial cancer.
And coming to the most common cancer, breast cancer, how do we identify the symptoms for that?
Yes. So that is also a very, very important problem. Previously, 10 years back, breast cancer was the #2 cancer. But now in urban India, breast cancer is a #1 cancer. We see around, on an average, 1,75,000 to 1,80,000 new cases of breast cancer every year in our country. The signs and symptoms are, the most common symptom is a lump, is like a growth that you will feel in your breast. Excess discharge from the nipple, it might be a white discharge or it might be a bloody discharge, is another symptom. Another signs and symptom is, in advanced stages, we see patients having difficulty in breathing, especially when the cancer spreads to the lung. And again, weight loss is also an important sign and symptom of breast cancer.
Okay, since like it's 21st century and with that, as the year has progressed by, the advances with the science and technology has progressed drastically. Has there been any advances with the gynae-oncology?
Yes, absolutely. We are fortunate and we should be creditable to the scientists and all the researchers across the world. Cancer treatment has definitely changed from what it was previously and what it is now. So we have more and more advances in treatment, both for surgical aspects as well as...
So doctor, we have a phone call coming in and
yes.
we will receive the call.
Yes,
well, hello.
Hello.
Hi, apuni korpora koi ase?
अच्छा मैं खुद नहीं सुनी मतलब ओवरियन कैंसर में प्रिकॉशंस किस तरह से हम ले सकते हैं और क्या ये क्यूरेबल है, कंप्लीटली क्यूर होता है?
क्या आप दोबारा रिपीट करेंगे क्वेश्चन को?
ये ओवरियन कैंसर, क्या इसका प्रिकॉशंस किस तरह से हम ले सकते हैं? अगर ये कैंसर हमें है तो कैसे प्रिकॉशंस ले सकते हैं और क्या ये कंप्लीटली क्यूरेबल है?
Yes. So as far as I think she was asking what are the precautions that you can take.
Yeah.
So precautions as such, there are no precautions that you can take. But if you have any of these symptoms that I have mentioned, just say if you have to go and pass urine more frequently, or if there is a diagnosis of an ovarian cyst previously, or if you are having a swelling of the abdomen, or you are having a sensation of feeling of unwell, then you should consult a doctor. Coming to your second question, ovarian cancer is definitely, if diagnosed, is definitely curable. Our science has advanced both in terms of surgery as well as in terms of medical treatment, which is chemotherapy. We have more and more surgical techniques coming up, because of which the cure rates because of both surgery as well as medical advances, the cure rates have definitely improved since the last 10 years.
Okay, doctor, we will take a short commercial break and move on to the break, and we'll come back with more reports on this very big topic of gyno-oncology.
Yes, sure.
Welcome back, viewers, and we proceed with the questions of the advancement in the gyno-oncology. So, sir,
Yes.
proceed.
So as I was telling you, science has advanced a lot. We have advances in all the three modalities of treatment of cancer, primarily surgery, radiation, and chemotherapy. The advances in surgery are that our technology is improving. Previously, for cancer patients, we had to do an open surgery, that is, take a big cut on the abdomen and then do the surgery. The implications of this was that patients had needed more time to recover from surgery. Pain is something which nobody likes, so pain was something which was very, very distressing. Patients could not have their food immediately after surgery, and all of this meant that you would be away from your office or from your work for a longer period of time. So we have advances like which are called as keyhole surgeries. So where instead of a cut on the abdomen, there are small holes which are put, and we use long instruments and we operate through that. All of that means that your pain is reduced by around 70% than what it was previously. You can start your food immediately within 4 hours after surgery. That means that you don't have to stay in the hospital for longer time, because the no amount of hospital, how much advanced it is, nothing is as comfortable as your home bed. So patients can be discharged early, and all of that means that your quality of surgery is much better, and all of this means that you miss your work little less. So there is also an economic factor also to that. So there are two basic advances. Either one is a laparoscopic surgery, which is the earlier one, and a more advanced form of surgery, which is robotic surgery.
So we have another call coming in. So hello.
Hello.
You may ask the question. Apuni prashnoto khudhibo pare Hindi naiba Englishot.
অসমত ক'ব পাৰিনে?
হয় হয় পাৰিব।
তাৰমানে মোৰ ব্ৰেষ্ট কেঞ্চাৰ ডিটেক্ট হৈছিলে। মই লাষ্ট ইয়াৰ মই অপাৰেশ্যন কৰিছিলোঁ মাইক্ৰডাক্টমী বুলি কেনে। তাৰপিছত মোৰ এতিয়া তাৰমানে 1 বছৰ হ'ল। এতিয়া মানে মাজে মাজে বস্তুটো মোৰ অলপ বিষাই থাকে, আৰু তেতিয়া 2% কেঞ্চাৰ মানে মই মানে টেষ্ট কৰোঁতে 2% কেঞ্চাৰ পাইছিলে। এতিয়া মানে যিখিনি জাগাত অপাৰেশ্যন কৰিছিলোঁ সেইখিনি জাগাত অলপ পেইন হৈ থাকে। তাৰ কাৰণে কিবা প্ৰব্লেম হ'ব নেকি, নে আৰু বেলেগত বিয়পিছে নেকি, সেইটো জানিবৰ কাৰণে বিচাৰিছিলোঁ।
আচ্ছা, আপোনাৰ এবছৰ আগতে অপাৰেশ্যন কৰিছিলে ব্ৰেষ্ট কেঞ্চাৰৰ, আৰু এতিয়া আপোনাৰ পেইন এটা হৈ আছে।
হয়, মানে অপাৰেশ্যন কৰোঁতে মোৰ কেঞ্চাৰ হোৱা মানে ধৰা পৰা নাছিলে। তেতিয়া মোৰ লাম্প এটা ধৰা পৰিছিলে। লাম্পটো ধৰা পৰোঁতে তাৰপিছত সেইটো মই ইয়াতে 3 years মানে গুৱাহাটীতে আপোনাৰ ট্ৰিটমেণ্ট কৰিলোঁ। 2019 ফাৰ্ষ্ট মোৰ ধৰা পৰিছিলে। তাৰপিছত 3 বছৰ মই মানে ইয়াতে ট্ৰিটমেণ্ট কৰোঁতে তেতিয়া লাম্প হোৱাৰ কাৰণে এইটো বিনাইন হয় বুলি কৈ কেনে মানে বস্তুটো সেনেকৈ ট্ৰিটমেণ্ট চলি আছিলে। তাৰপিছত মই 2020 মই চেন্নাই গ'লোঁ। চেন্নাই যাই কিনে তাতে মই অপাৰেশ্যন কৰিছিলোঁ। তাতে অপাৰেশ্যন কৰাৰ পিছত এতিয়া মানে মোৰ অকণমান বস্তুবিলাকে অলপ পেইন হৈ থাকে।
Okay, so what she's asking is that she went through an operation by 2019 where she had recovered a lump in her breast, and she went through an operation, but she's having a pain right now, and they supposedly she's having to have thought of to be a cancer. So what is recommended to her? I think
so. I think she will need to consult an oncologist, a breast specialist, depending on what the lump is. Then and doing further some tests, then she needs to take treatment for what is the situation.
So she found a lump on 2019. She went to an operation. She's having a pain right now, and she is frightened that it might be a cancer. So it's good that if she goes for a gyno-oncologist.
Yes, absolutely. She should
see a
specialist.
Will she be? What do you prescribe? Like where to go and where to check it out?
So I mean, depending on where she is based, if she is based in Guwahati, she can visit any of the hospitals here who have cancer specialists. And consult a specialist, gynae-oncologist for the sake.
Okay. So আপোনাৰ ডক্টৰে এইটো ক'লে যে আপুনি ইয়াতে গুৱাহাটীত নহলে বা তেওঁকো কন্টাক্ট কৰিব পাৰে গাইনি-অনকলজিষ্ট যোনে এইবোৰ ক্ষেত্ৰত চাই। এবাৰ আপুনি যদি চেকআপৰ কাৰণে যায় তেতিয়া হলে আপুনি ধৰাত পৰিব যে একচুয়ালি আপুনি নেক্সট স্টেপত কি কৰিব পাৰে, নহলে বা তেওঁ আছে আপোনাৰ নম্বৰটো আমি শেয়াৰ কৰি দিম, আপুনি তেনেকৈ কল কৰি ল'ব পাৰিব।
Yes, they can contact me as well.
Yeah, okay. So continuing with the second question, you are a gynae-oncologist and also a robotic surgeon. So what is robotic surgery?
Yeah. So robotic is basically an advanced form of laparoscopic surgery. So as I was telling you that there are keyhole incisions, so small incisions which are just 8 millimeter. The instruments used are long instruments, and which the instruments have a robotic technology. So we have not reached a stage where the robot does the surgery. It is a surgeon who controls the robotic instruments and does the surgery. Now all of this means that the instruments have a lot of precision. Like if, for example, if I want to move the instrument by 1 millimeter, it will move exactly by 1 millimeter. So the cut on the body is much less. The blood loss during surgery, koi bhi surgery, in any surgery there is blood loss which happens, that can be reduced by at least 70 to 80% in robotic surgery. All of this means that our patients are recovering quickly, they go home early, and they have absolutely zero pain after such a major surgery.
So can you tell us one of your successful story in this regard?
Yeah. So we had this lady around 60-year-old who had come from West Bengal, and she was very obese. She was on the healthier side. She was weighing around 140 kgs. Now, and so and she had other problems as well. She had diabetes, she had hypertension, she had heart disease as well. Now all of that meant that doing an open surgery on her was very risky, primarily because you would have had a big cut on the abdomen and there is a more chance of wound infection. Now we did offer her a robotic assisted surgery, and by God's grace the surgery was successful. She recovered well. She was discharged on the very next day after surgery. Normally if we would have done an open surgery on her, she would have been in the hospital at least for 7 to 10 days. And also it's important that considering all her other comorbidities like heart disease, hypertension, diabetes, robotic surgery was her quickest way of recovering and getting back to normal.
Okay, so how many successful operations through robotic surgery you have done so far?
Yeah, so now till date we have done about between 350 to 370 surgeries.
In a span of?
That is in a span of last 4 years.
Span of, sorry?
4 years.
4 years. Okay, now coming to the thing like you see the key signs of a cancer, so you will have to go through some tests. So
yes.
What are the tests? You have to go through tests to diagnose the cancers, and are the results sure enough to signify?
Yeah. So as far as diagnosis of cancer is concerned, there is always not a single, I mean it's just not a single test, it's always a combination of tests. Now primarily the first test which is done when you are suspecting a cancer is to take a biopsy. Now biopsy means that from the tumor you take a small piece of the tissue and it is sent to the laboratory for testing, that is whether we are seeing cancerous cells in it or no. That is the confirmation of cancer. In addition to this, there are also some other tests which are done which will tell us how much the cancer has spread. The primary tests done are the CT scan or the MRI scan or the more advanced test which is called as PET scan. That will tell us what is the stage of the cancer. In layman terms, it is that how much the cancer has spread. Now in addition to these two basic tests, there will be some other tests which are done, especially whether to check whether the person is fit for treatment, that is fit for surgery. That might include tests like blood test, an ECG or a 2D echogram.
Okay, so coming to the treatment options, what is the cost? Can a financially backward person opt for the operation?
Yes. So of late, we all know that cancer treatment is costly. All this technology comes at a cost. So till now it was all thought that this is all unreachable as far as a common man is concerned. But we have different government schemes. We have definitely a lot of insurance companies supporting that. In addition to that, there are a lot of government schemes. The Ayushman Bharat Arogya scheme, which is a Government of India flagship initiative, has done fantastic job, and it is supporting patients up to 5 lakhs for their treatment. In addition to that, the Government of Assam is also supporting patients in their fight against cancer. So these are all the different schemes which are available and which patients can utilize, and they can take a proper treatment. It is very important that one should not neglect your symptoms. Please, they need to seek help, because cancer, if we diagnose in early stages, the cure rates are quite good.
Okay, so coming importantly to this question, what are the options available for the women who wish to maintain their fertility?
Yes. So now see, in the last 10 years, this question is very, very important because as I discussed with you, we are seeing more and more younger patients. If you look at 10 years back, the uterine cancer was mainly in women above 50, but now we are seeing women as young as 20, as young as 30 getting this cancer, and some of them are not married, some of them are married but don't have kids and they want kids. So in them, a special initiative like something like a uterus preserving treatment is available, where we treat them with a combination of medical tablets and a special device called as a Mirena coil. So this is a temporary treatment which we give, and when there is good response to treatment, then we send the patient to a fertility clinic, that is through a IVF or other technologies, to get pregnant as early as possible. And once the pregnancy, when the lady gets pregnant, she has delivered the baby in about 1 or 2 years, then we plan for the definitive treatment. So this is what is.
So how are we to prevent such cancers?
Yes.
Is
so
this completely curable?
Yes. So this is in early stages, it is completely curable. That is why it is very, very important that the symptoms are not neglected. Like I said, any excess bleeding during your cycles, or excess bleeding in between cycles, or excess white discharge, you please need to seek help. Cancer diagnosed early has excellent survival. The survival rates in cervical cancer and the uterine cancer is in first stages is more than 95%.
So we have come to the end of the time, and lastly, what would you like to send a message to our viewers today?
Yeah. So as I told, gynec-oncology is one of the important cancers and which affect women. It is very, very important that screening is done, like something like an early test like pap smear should be done, which will detect the cancer early. Please don't neglect your symptoms. Please urge your women, it might be your mother, it might be your wife, it might be your sister, to please seek help. And cancers which are detected in early stages, the cure rates are excellent, and because of newer technologies, one can go back to their normal life, lead a normal life as normal as possible. There is no need to get stigmatized by cancer. Cancer is no longer a taboo. This is a disease which we can overcome by good, proper treatment. So please seek help and the help of your specialist. Thank you.
All right, that's all we have in this episode of Good Life Health Show, and thank you so much, Dr. Ranade, for joining us and enlightening us with this very big topic of gyne-oncology and robot surgery. And well, viewers, keep watching Notice Live, and thank you for watching.
Thank you very much.